The other most sensitive position in a government is being a health minister. Something goes wrong, people get very agitated, people get worked up.
What do you think are some of the biggest risks in today's food system?
There is contamination in everything, from the food we grow, to the air we breathe, to the water we drink. Cotton candy, the pink coloration that they're using is carcinogenic substance. We banned it. After that, we took up all these kebabs and gobi Manchurian. So suddenly people started looking and yes, why is this kebab so red? This may not be that healthy.
Yeah. Pani puri, which is a favorite of a lot of us.
See, pani puri is a prime suspect, you can say.
Idlis can have so much of microplastic, and idlis are known to be like the safest.
A lot of places people start sending us photographs. Sir, this restaurant they're using plastic. This someone from different places.
All the delivery that is happening today, and so much of ordering in that we're doing, and the containers that it comes in.
Maybe, that's the next thing that we should do.
So there's a report to say that your tea cup releases more than 2 lakh nanoplastic every time you have.
Tea powder itself has become a substandard product.
How do you think the food system really got to this place? Like, when did it become so bad?
The bigger worry is the food that we're eating, which is being sold in the market. Processed food, sugar, salt, fat, all this. So that I think has got huge impact on our health. Government of India and nationally, I think we need to become more aggressive on this. Even in schools, I think it should become part of the education system where children are told about these things.
The stunting rate is at 41.2%.
It's a long chain, starting from the health of a girl child. The health of a woman is much more important than the health of a male, I feel.
86% of paneer in India is known to be adulterated. On the other side, Indians are known to be protein deficient.
For people who eat paneer, it's a good source of protein. We want people to become demanding. People should say that this is what I want and this is what I don't want.
How does a consumer become vigilant of these things? Hello, Health Minister. Welcome to Good Food Talks.
Hello. Thanks for calling me for this program.
Thank you so much for agreeing to be on this show. What we do on Good Food Talks is, we've been having a series of conversations in the space of food. There's a lot that has gone wrong with food in today's day and age. What our parents could easily eat thinking that this is pure, this is healthy, today has to be looked at, with a microscopic lens. And hence we're having conversations to basically create awareness around this space on what are some of the things that you really need to think about that is happening in the food ecosystem, which you may or may not be contributing to, but it's definitely affecting the food that you eat and your family eats. We've had different guests so far who have come from various walks of life. We've had people who've spoken about climate change and the impact of climate change on food, waste in the cities and the impact of waste on food, and water, the kind of water that is there in today's day and age and the impact of that on food. So today we're really, really thrilled to have you here, to have you as a part of this show, because we feel like there's so many questions that we all have that I feel like is going to get answered and clarified through you.
Sure, I'll try and answer as to the best of my ability.
Thank you so much. A common man, does not really fully know what a health minister does. So what does your day look like?
No, health minister, of course, it's a huge responsibility because one is we have to take care of our health facilities, and there are always issues which keep cropping up on a day-to-day basis, and we have to be alert. And you know how the government system functions, so there are always some lacuna, some deficiencies, and we're always trying to set things right. So the challenges in terms of administration, challenges in terms of delivery. And of course, new issues keep cropping up, new diseases keep cropping up, or something other that keeps happening. So we have to be on alert mode most of the time. So that way, I think in a way, I think after the Home Minister, that is who's in charge of law and order, the other most sensitive position in a government is being a health minister. Because it's very sensitive. Because something goes wrong, people get very agitated, people get worked up. It is definitely a very challenging task. So my day-to-day is always morning, check the news first, health news, what's happening, what is the latest. I think every day is a little bit different, but we keep trying to attend to all the issues that keep cropping up. Yeah.
So what part of it, how much of it is around the space of food and how much is in the space of disease and disease management?
See, health is basically, it is for us, the whole focus tends to be on hospitals and medicines and how we can prevent onset of diseases and all that. So for a government, see what happens is there are two parts. One is how we can prevent onset of diseases and how you can cure once the disease falls on you. So the curative part, I think there are a lot of people in the curative space. There is government, of course. Then there is private hospitals and clinics and nursing homes. There are innumerable number of people who are catering to that segment, including us. But on the preventive part, I think there are hardly any people. So it becomes more of my responsibility and the government's responsibility to try and focus on the preventive part. So preventive part normally tends to be what we look at screening, early screening or early detection, and try and see that we catch the disease early, or at least. And the other part that becomes most important is how we can lifestyle becomes important. That's where food comes in. So that's how the focus on food became more for us, because on the preventive part there's always less focus. Because it doesn't really catch news so much, or it doesn't give you immediate returns. Now, as a minister, if I go and build a new hospital, or if I sanction a new hospital, there's a lot of PR there. So there's a lot of public response. Oh, that the minister came, he sanctioned this, he got this done, all that. But if I focus on preventive, it is a long-term game.
So true.
So the attention that is needed for that has always been less, I feel, even in the center and even the state. So we started looking at that. So one was how we can detect early, and what is causing these diseases. So some of the major causes of disease today is our lifestyle and food habits and the way we live. And of course, along with that, the stress that we go through and all those things. So for that, I think we need to educate our people. We need to get them involved. We need this to become a part of discussion. So that's how I think we started looking for the first time. I think that a lot of focus came on food. How we can make food a point of discussion. It should become something that government is doing, and it should have news value. So that's how we started, looking into the food. The food safety department also is part of the health ministry, along with the drug control department. So quality of medicines and quality of food both become important.
Brilliant.
Yeah.
We work in the space of organic, and over there also there's a parallel, because when you become an organic consumer, it's a long-term game.
Yeah.
You'll not see immediate, can I tangibly tell you if you're going to have organic immediately you'll start seeing results? No. But if you believe in the concept of organic and you start making that change, you'll start seeing a difference in the long run. So
True.
yeah, I think food plays such a critical role in the kind of food and quality of food.
The kind of food and the quality of food.
Absolutely.
You're right. Absolutely right. So that's how, when I became minister, then we had a discussion with our food commissioner and all that, and said, okay, now what are you people doing? And they were just doing some regular tests, but nothing which had any real focus. They were just going, sampling few things, and maybe issuing some licenses or cancelling some licenses, like that. So I said, how do we make this a public issue? So the first thing we looked at was, we got some information about certain products. Cotton candy, which some of the people told us that the pink coloration that they're using is carcinogenic substance. So then we said, okay, let's look at that. And once we did that, then we found out, yes, what is not supposed to be used, banned products are being used to give it that pink color, which makes it look attractive. So then we banned it, and now you will tend to see more of white candies. So that was an immediate impact. And the thing was, that became a big news.
Yes.
So suddenly it got people's attention. After that, we took up all these kebabs and gobi Manchurian, where we heard that a lot of things coloring agents are being used, and it was true. And we did a lot of samples were taken, surveys were done, and we found that a lot of them, quite a high percentage, by adding this sunset yellow and tetrazine, rhodamine, all those kind of things. So then that became news, and suddenly people started looking, and yes, why is this kebab so red? This may not be that healthy. So that is one thing. And second thing, I think also, people who make these foods, like say the person who's cooking it, he himself doesn't realize that this is harmful. He's just doing it because he's taught, use this, it makes it better. So even the guy who makes it also became aware that I shouldn't do this. So it's not just that the consumer, but also the person who's the maker. So that became the next thing. So like that, as then I said, okay, now let's target everything, something or the other every month. Take up some product, some food, or some areas. So we started looking at all our government hostels and Anganwadis and how is the preparation there, how are the canteens there. So this has become like a regular process now, and I think it is bearing fruit to some extent. I feel of people being aware of the food, the quality of food. I think it became a talking point, a subject of discussion.
Yeah.
I think that was what we really wanted. Yeah. Along with, of course, the enforcement, which is our duty, or who's not adhering to the laws. So that we take action, we book case, then we fine them. All that is going on, but we want it to become
a conversation.
A conversation. And I think to some extent, I think we've succeeded. Maybe we should do more.
Yeah. I think these conversations were happening in like really small pockets before.
Yeah.
Like for example, like in the parenting community, for example, right? Like there's a lot of conversations around sweets, that candies and things that children eat, which have all these colors. Right, like there are, and I don't want to name brands, which are there, right? So you try to kind of avoid all of that. Cakes, for example, every birthday cake is filled with some of the colors that possibly you are also mentioning.
Yeah,
right?
we did cakes, and we did 2 rounds. First round we found a lot of this. Then we had booked a lot of cases. Then the second round we did recently, about a few months back. We found that a lot of the things had improved. They had stopped using it.
Okay.
So, that gave us a good thing that at least, okay, fine. To some extent, it has had some impact.
Yeah.
You know?
I mean, action starts happening immediately. Is that how you're seeing it?
Like I said, candy immediately. Even kebabs, we saw some immediate. Paneer, we see a lot of paneer, a lot of substandard, or because it's a sensitive product, dairy, so it tends to deteriorate.
Yeah.
So paneer is one another issue. Then, then we started looking at water, drinking water, and so we found, of course, the good branded people. Their water was of good quality, but the local brands, you see a lot of local brands in all these small towns. Each one has got a brand and they claim it to be mineral water.
Yes.
So there's a lot of unwanted stuff in it.
Yeah.
So then we took action on them. I think then people realize that better to buy better quality bottled water than these local brands.
Yeah. Because I think when you go, you say, is it mineral water? They said, yes, mineral water. No one's asking what brand. Yeah. You're also a policymaker. You are deciding what this entire generation is going to eat or not eat. What does that feel like?
I cannot decide, I think. But of course, food is having a big impact on health.
Yeah.
So I think health is literally it's in your hands now. Good health is in your own hands. Apart from exercise, all the food is playing a huge role. I think now a lot of propagation is going on about not to eat, this high sugar, high fat, trans fats, all these kind of foods. So educating them at a younger age, even in schools, I think it should become part of the education system where children are told about these things, because we see so many younger children getting diabetes and younger children obesity, diabetic, and blood pressure, and early onset of non-communicable diseases. So all this is directly linked to our lifestyle and food.
Yeah.
So of course, pollution is something that environment is a massive problem, and there is contamination in everything, from the food we grow to the air we breathe to the water we drink and everything. So, but then we can't end up saying that okay, things are so bad. Let's not. What can we do? But I think every small thing is important. When people become aware and people start acting and government starts enforcing, I think somewhere these things will eventually we will reach definitely a better stage, and we can expect better outcomes.
Right. Like the rhodamine issue that you spoke about. There are dyes that people have been using. The peas are being colored extra green, right? And there are many such issues that I think you have, yourself identified over the last few months. How do you think the food system really got to this place? Like, when did it become so bad?
Well, I think because of one was the people started buying a lot from outside instead of making at home.
Yeah.
naturally because of the lifestyles changed, living conditions changed. So people didn't have the time to do it at home. Second thing, of course, consumerism. There is so much of various products available in the market. So I think there's competition, and you want to attract the consumer. So you make the food not only be nutritious but make it look good. So it became like how to make it more appealing, or how do you make it look better? So to attract the person to you, so that he buys it and eats it. So I think this has been developing over a period of time, and there's been no proper regulation. Still, there is. I think we are still way behind. I feel we can do better regulation, and better systems can be put in place. Just like how we started regulating on tobacco and cigarettes.
Yeah.
I think a similar thing can be brought into these high risk foods,
Absolutely.
where people know the danger and should be made obvious. We still need better laws, but I think this is built up over a period of time, and people are willing to go, make a quick buck, make it as profitable as possible with with lesser, standards.
Yeah.
So I think this consumerism and people wanting, something to be tasty and to be more
Visually appealing.
visually appealing. So all these things have added, I think.
Yeah.
Marketing it in a way that makes people buy it.
Yeah. Same problem in the organic space as well, like I think you want your apple to be super shiny and it looks just perfect. Your carrots have to look perfect. Everything has to look perfect. But nature is not making everything perfect, isn't it? And
True.
so that's, I think, an issue that we are also facing. And somewhere I think we're trying to kind of communicate it to the consumer, saying it's okay if it doesn't look good. As long as it tastes good, that's what, and it's nutritious for you, that's what should matter.
Yeah. Waxing it and adding some substances to make it look, polished and bright.
Yes.
So these are, I'm no food expert. I'm not that I was an expert, but being in the health ministry, I've been, going, though I had layman's knowledge about it, but I think being here, then start looking at it, we're understanding so many things that is being done in the industry, which is not good. And we are misleading the people.
Yeah.
Not only, it's not just adulteration or using substances which are not supposed to be used, but also misleading, misbranding it, misleading people. So these are also things, where we need to be, regulations need to be, I think, more stronger, so that we can tighten these people when they do that. So that's something that, because these are all these laws are made from Government of India.
Yeah.
So these are all central laws. So I really cannot make my own law in my state. So we've been mentioning this to Government of India, and because of certain things that we did, they've also taken things up.
No.
So that's good.
So while we are doing all these bans and saying that, you can't be doing this, you can't be using this, are people really implementing it? Like how many hoteliers and vendors are, taking action based on the ban that you're putting forward?
See, now for us, we have a limited staff, so we can't be going to each and every place and looking. But we keep doing a drive every month on some product or some institution or the other, like street vendors or manufacturers or hostels and schools, like that, and certain products that we hear about, and we choose that product. So like that, bakeries, sometimes we'll go. So we can do that, but ultimately, I think it needs some sort of awareness. The consumer should demand.
Yeah.
I think it's going to come down to that. That the consumer, the person who buys food, he should become more vigilant. He should become more, aware of these things. And when he buys certain things, he should demand a certain quality. Certain standard.
Yeah.
And when that happens, I think things will change.
Yeah.
And of course, I'm sure that many people looking at what we're doing, they may have corrected themselves, and many may not have also. So that is something that we need to keep doing more from our side.
Yeah.
Yeah.
Like at Akshayakalpa, one of the things that we keep doing is we tell people that you need to know where your food is growing. If you don't know where your food is growing, you don't know how it has been grown, you don't know what has been used, what pesticide, what chemicals, what fertilizers, you don't know. So we tell them, why don't you come to the farm, spend 2 days at the farm, see how your food is being grown. But every time we have this conversation, like with, marketers or industry leaders, one common feedback we receive is, what you're talking about is just a very small percentage of the audience.
Yeah.
In general, people are not doing this. But listening to you speak right now, and you are, implementing this at a mass level, right?
Yeah.
You're saying everyone should be asking this question. It gives me like a lot of hope that, like, this entire journey of everyone moving towards questioning what is in their food is possibly going to get fast tracked, and a lot is going to happen at a different speed, which is going to in overall improve the quality of
Yes,
food.
I'm sure. Because the more people, especially younger people, because they're the ones who at a younger age, like I've been noticing, a lot of young people today are thinking about the kind of food they're eating. I've been noticing it with my own daughters. I'm noticing with my friends' children. I'm noticing that they are demanding a certain kind of food. They don't want the junk food.
Right.
They are looking at more healthy food. They're looking at food which is like not processed. So that's a good thing, because when it gets into a younger person's mind, I think that has a huge impact on the parent, on the family also. Because when the child says, I don't want this food.
Yeah.
Like yesterday I was having a conversation with one of my friends. So he was saying that I order always every day once or twice or at least in a week 3-4 times from outside.
Right.
But my children, they don't eat that food. So he said, now I am thinking that, but should I eat this food or not?
So
So
nice.
the children are impacting the parents.
Yes.
Because we are used to a certain way of doing things.
Yeah.
And they can change it.
Yeah. No, I think like we could afford it, like, because food was not that bad, now.
We can say, relatively speaking, we were in a better space
Yes.
because most of it was home cooked or gone to the markets, freshly brought and got back. So there was less amount of transportation and storage.
Yes.
But today the thing is, what's happened is we want food from all over the world.
Yeah.
So you want some New Zealand apple and some Australian thing or some American banana or whatever. So, that is something which is, I think, ultimately not good.
Yeah.
Because there is a lot of processing that will take place, or storage conditions which it has to be stored, and cold storage and all that. So ultimately, the fresher, the better.
Yeah.
The nearer it is to you, the better it is. So I think these things, the society has to evolve.
Yeah. The other thing also with youngsters, I feel, is that because the number of diseases are starting so early on in their lives, and they are seeing it in their circle, that they are also being more conscious about.
Yeah. I think that's also there. I think, especially in the urban and educated youngster, they are aware of this.
Right.
So that's like you said earlier, it could be a smaller segment.
Yes.
The majority of the segment is not really looking at it because they are looking for survival. They're looking for getting their basic food at a low cost.
Yeah.
They don't want to pay high cost naturally because they can't afford to pay heavy costs.
Yeah.
But ultimately it will seep down. It will come down. This whatever is there at a slightly elite or whatever more educated level, that will definitely it'll start coming down, and everyone will realize this.
Yeah. And if it's happening at a policy level, and if the conversations are happening at a mass level, then that awareness and I think little bit of that dissonance gets created where people will start feeling like
they are, because like what we did, because even the media likes this news. So media has to really like blow it up more than what we also said, like on the television and all that. So this food is not good. Government has found out this. Candy is bad. Kebabs are bad. So that became big news.
Yes.
So that will affect everyone. Everyone watches this. Everyone watches TV and news today. And of course social media. So I'm sure people even in the villages or even in the slums or even lower weaker section people, they are also watching this, and they're also saying, okay, fine, now what can we do about this? Within our own limitations, how we can improve it. I'm sure it at least it'll start making them think.
Yes.
And that's what we want.
Yes. I think that question comes to your head, then you're going to look at everything differently. It has a snowballing effect. Pani puri, which is a favorite of a lot of us, seems to be having.
Yeah, obviously Pani puri is like a clear case It's a prime suspect, you can say, because of the water and the handling, and basically also it's a lot of street food.
Right.
So of course, chaats and pani puri also we did. I mean, this is we've been doing across many of these things we've done.
Right.
And, as far as possible, like even in malls, like we start. So we want to get people involved. So we thought of an idea of why don't we put kiosks in malls where people can come and test their food.
Yeah.
If they feel if there is a doubt. So we did put up 10 kiosks in 10 different malls in Bangalore. So the results have been kind of uneven. Many people have used it to just check the food quality.
Yes.
And basically it's been okay. But I think we need to evolve it into a better way of doing it.
Right.
So what we're thinking is, can we run, like suppose you want to find out the quality of the food.
Yeah.
Where do you go? So it's a problem.
Yeah.
So whether we can have some sort of a system in few places in the city or wherever, where people can come and get their food tested or for basic things.
And when you say food, you mean ingredients or you mean
like even cooked food, or if they bought some food from outside or ingredients, whatever that is possible for us to check in a facility. So we are looking at that.
Very nice.
So where public can come and they can't go look for a food safety lab, or they can't come to my office and give a complaint on that. So some accessible places.
Right.
So we are trying to work out some system like
so
that.
we went to a mall just before.
What was the experience?
It was very good. I think the team has gone and got
Was it
the food.
Useful, or was it
maybe because it is happening in the same mall.
exactly? So there's no incentive for them.
Yes.
To
To say against, to speak against the
exactly
outlet.
Yeah.
So I think like they
So-
prefer giving a positive review
Yeah.
than a negative review.
Correct. So that's the problem. So that's what. So I said that's what I meant when I said this response has been uneven. So you need to find neutral places
Yes.
where it's accessible. And suppose you buy gold, you want to check the quality of your gold.
Yes.
So you can go to a evaluator and you can get it
Correct.
checked, right?
Yes.
So something similar to that.
Yeah.
So we are thinking how to do it.
In milk, it is Sipet, right? Like Sipet is the one who kind of gives
Yeah.
you those reports.
They give you the reports.
Yeah. No, I think that'll be very empowering. Like if this spreads, right? Like because again, the whole concept of testing what you're eating is happening in very, very small pockets, right? Like people who are extremely deeply involved are the ones who are going and getting their food tested.
Yeah.
The second level possibly are people who are saying, I will go to a brand that I trust, or I'll go to a farmer that I trust, right? They'll say that, okay, if I know this is the farmer, I know his land, then I'll go and, buy from that person, but I'm not going to break my head trying to test the food, right?
Correct. We got to evolve a good model which is like practical and workable.
Yeah.
And, then we'll see. We are working on it.
Super.
Yeah.
Okay. I recently went to Veena stores in Malleshwaram, and my eyes first went to the idlis, and I saw that it was being made on a cloth and not the plastic sheets. That was a phenomenal, I think, insight also for us that, like idlis can have so much of microplastic, and idlis are known to be like the safest, healthiest comfort food. And how, why do you think it reached that place? Like, because we've had banana leaves, we've had cloths.
I think it just makes it easier, because I just observed this in a few places and it never registered to me. So after becoming minister, suddenly we were just thinking and said, okay, what about this? They're using plastic. Just take a look at this.
Right.
So then I told my commissioner, this is why don't you take a look? And then they went and did a drive, and then they found out, a lot of places using, and it's not, you shouldn't use it, because you're heating, steaming it, and then using plastic, so that it leaches into the idli.
Yes.
That's not done, and then that became big news. We didn't expect it to become such a big news. Suddenly, all TV, everyone is all showing this all over.
Yeah.
And it had, I think, one of the fastest impact was on this using of plastic on idli.
Yeah.
And then, a lot of places, people started sending us photographs. Sir, this restaurant, they're using plastic. This someone from different places. So there's some good places, like I think, I don't know, not Veena stores, I think some other place in Malleshwaram only that was still continuing to do it. Then suddenly somebody put it out on social media. So naturally the restaurant persons changed their...
So citizens started policing.
Yeah, so they started policing it. So now I think it's more or less, it has had a good impact, and we've seen the result. So that was a good thing, I think. Yeah.
What about food, like all the delivery that is happening today and so much of ordering in that we're doing,
Yeah.
and the containers that it comes in? Again, there's a lot of heat that goes
I mean,
to
we
it.
need to address, I think, the kind of containers that they use. So maybe, I mean, that's the next thing that we should do.
Yeah,
So I think that's what we should focus in next.
right.
What are the kind of containers and plastics, and even like when they serve tea.
Yes.
In fact, we found tea to be a lot of.
So there's a report to say that your
Yeah.
teacup releases more than 2 lakh nanoplastic every time you have.
Tea powder itself is become a substandard product because they add some coloring agents and they use some pesticides. Whereas in coffee we didn't find it.
Right.
We were not finding it. But in tea, lot of the samples were failing. So that's another thing that we started. We've been trying to warn and tell all the people, especially the local manufacturers. They make all these things.
Right.
So
How does a consumer become vigilant of these things? Like, what can.
well, I mean, we'll make them aware of it, and you should know. I think first of all, you should know to buy good standard products. That is one thing. And as far as we found coffee, we didn't find any problem with any of the coffee powders. Whereas tea in those tea bags, that was a problem that we were finding. But anyway, I think this is a never-ending issue.
True.
So I think it's a constant thing that we got to keep on working at it and not letting go. Nothing can be done overnight, but it's a constant pressure we need to keep on putting on the manufacturers and producers of food.
Yeah.
And at the same time, making our consumers aware.
Yeah.
Yeah.
You were mentioning about paneer, and the whole adulteration issue that happened.
Yeah.
So there's a dichotomy over there, like on one end, the paneer, 86% of paneer in India is known to be adulterated.
Yeah.
On the other side, Indians are known to be protein deficient, right? Like 70% of India does not even consume as much as protein that we should be consuming on a daily basis. Paneer being a great source of protein. Now, like if you think of it from a consumer point of view, right? Like there are two battles that this person has to fight. One is, how do I make sure that I'm eating enough protein, right? And in that list, maybe paneer is going to feature, saying that, okay, if I eat more protein, paneer, I'm going to make up for it.
True.
But and how do I make sure that the paneer I'm now eating is not adulterated? So it's like a double-edged sword as far as the consumer is concerned, isn't
It's a
it?
catch-22.
It's a catch
So should I eat or not eat?
Yeah.
Well, difficult choices. Now, what to do? I mean, on one side, of course, we can't say don't eat paneer. On the other hand, we are finding a lot of problems with the substandard adulteration, all that. Because it's a dairy product, so there's a lot of microbiological, deterioration that happens. So ultimately, I think improve the standard of paneer. That's all. Better quality paneer. Because for people who eat paneer, it's a good source of protein.
Yes.
So we need to improve it. That's it. There's no other solution. We can't say people don't eat.
It goes back to figure out what paneer you're eating. And
Yeah. That's all. That's all we can do, I think. Hopefully, people who make it also will start realizing it. And it should be done I think Government of India and nationally, I think we need to become more aggressive on this.
Yeah. Like, because I completely stopped ordering paneer. Like every time I ate out after this news came. At home, of course, like we get Akshayakalpa paneer, so I know it's like really good and all of that. But outside, I've completely stopped, because even if it is like a very, very good hotel, you don't know what
Yeah,
paneer
you
they're
don't know. You
using.
don't know. And it leads to indigestion and stomach upsets
Yeah.
and all that. So that is the problem. So it has instant reactions.
Yes.
So certain things like food, okay, so it may not be having long-term health impact.
Yeah.
It may short-term like this.
Right.
But certain kinds of food have got long-term impact. So like cotton candy, you're not going to eat every day. No?
Yeah.
So you eat once in a while when you go out, and it may not have a long-term impact.
Yeah.
But certain foods, which are like, especially what is there out in the market, I think that is a bigger worry than this, because we are focusing too much on this. But the bigger worry is the food that we're eating, which is being sold in the market, processed food and ultra,
Yeah.
sugar, salt, fat, all this. So that, I think, has got huge impact on our health.
And
Long term.
Yeah, absolutely. And it's so habit forming. Like it's been designed to
Yeah.
get
So, and there people are just like, it's become a big business, big industry. that focus, I think, should get into that more. Of course, I'm not saying that what we're doing is not good.
Right.
It is good.
Yes.
Finding out all this kebab,
Absolutely.
this,
Yeah.
that. But I won't be eating kebab every day, no.
Yeah.
So maybe once in a while.
Yes.
But this kind of food that you eat every day, that is a problem.
And what are the plans on that?
See, this is this I think nationally it has to be tackled because it's not a state level subject.
Right.
Because manufacturers, they're all over the country and from all over the world, and they have their distribution network. I cannot ban any product. I cannot stop any product. So government of India also now is doing a lot of marketing that don't eat this, don't eat this. But I think like how they did with cigarettes, yeah, I think equally with this, if you start branding these foods as high risk, danger, people should know that there's danger. Not that you can't grade it in a way that they are in a way which is which doesn't make which doesn't show the obvious to them.
Yeah.
Now the way they are showing it is I think they have some coloring scheme and all that,
Yes.
which doesn't really register with people.
Yes.
So when you know that this food is bad and it's been proven, then you might as well tell people that this will cause your diabetes, BP, can lead to cancers, can lead to it does, and it's very obvious.
Yeah.
So that risk should be published on the food packaging. People should know. I think that's the first step. But I think then that's a huge lobby, and whether they allow it or not, I don't know.
Yeah, but I think that's a brilliant parallel of tobacco to processed food.
Yeah.
I mean, it's equally bad.
It's equally bad. It's equally bad. And because people are consuming it in huge quantities, no?
Yeah.
So chocolates and your chips and these are consumed in huge quantities and on a regular basis. We'll have to be part of the lobby, and hopefully at some point of time, the time will come when there'll be an inflection point. The government will strike.
Yeah.
Yeah.
I think like as a mom, like for me, there are like 100 no's that I have to say in a day. To say no this to my child. Distill it down to only those few things which are healthy, homemade. Even if I'm buying it from outside, like the amount of work that I have to put in to make sure that I'm only getting the healthy ones in is, I mean, the load is very heavy on the consumer who is now wanting to eat healthy and provide healthy food to her family. I think like such initiatives, I think will slowly start reducing that load. Where you're going to make it very transparent to everyone, saying that even if you're eating this, that this is not going to be
correct
good for you.
As long as you're aware of it, that okay, you may be still smoking, but you know that okay, there's no two ways about it.
Correct.
But you may be guilty about it, but you may still be smoking because you like to smoke. But that's another issue altogether.
Yes.
But at least you should know.
Correct.
And I think with cigarettes, we've reached that level. And we banned these hookahs in all Bangalore because we thought that, there's a lot of, not just tobacco, there was a lot of contaminants into that hookah that they were putting. A lot of, substances which cause more addiction to it. A lot of, opioid kind of stuff being put into it. So that people come to the bar, smoke the hookah more, and sit in the bar more. So, not that it wasn't just tobacco, it was like the other pollutants also, the other things that the narcotic kind of thing that they were putting into that. So, we banned it, and somehow the courts didn't overturn the ban. So, Bangalore is like, it's not allowed anywhere. So, but at least with cigarettes, with alcohol,
Yes.
You may be still drinking it, but you know that it causes. So, similar with food, people should know. Somehow, I think we're just giving it a social message, but I think it should be made more obvious.
Brilliant.
Is my point.
Yeah. So, what do you think are some of the biggest risks in today's food system? Is it adulteration? Is it malpractices, overprocessing, misinformation?
I mean, malpractice, okay, that is there in every segment, I think. And that is for the government to look into. And even adulteration is something that government has to look into, regulation, enforcement, all that. So that is something that we have to do more.
Right.
So that is something that we can do if the government puts its mind to it and start like checking and inspecting. But I think the bigger challenge is on the other side. Misinformation and processing and all that. The way we advertise food, the way food which is not really healthy for you is shown to be like really, something, wow, you need to eat this. So wrong advertising, wrong messaging, all these things is misinformation only,
Yeah.
So it is in a form of misinformation. So that is something that will we need, which needs more vigilance and more information to flow to the people and more awareness. That is for people to get to wean them off this and to go back to eating better food, maybe not as tasty and delicious, but more healthy.
Yeah.
So how do you make that mental shift?
Right.
That is important.
Yeah. Yeah.
Yeah.
How about milk? There's a lot of
Well, I'm not an expert, so I don't know, but people say that there are many people who cannot tolerate milk. One, so it is not something that humans should be consuming. Some people even say that. But milk is part of this country's diet.
Yes.
And to a large extent, it does give a lot of nutrition to people.
Yeah.
And milk and eggs and all that is like basic food, I think, that people consume.
Right.
So, I mean, I would not say that don't drink milk. I'm not going to say that.
Yeah. Like from an adulteration point of view, again, that's another, I think, places where it is being done in the not right way.
Yeah, I think so. But I mean, there's adulteration in everything, no? Where's there is no adulteration? Which product is not adulterated? So, how do you source the quality milk is important. But I think generally, the branded and good companies, their milk quality will generally be good.
Right. So like this whole issue with water that happened, right? Like, and we figured that, and when we go to restaurants, we order like juices and we order, and then whenever they make those juices, they say, yeah, we're using mineral water. So who does the responsibility lie with over there? Like, is it the consumer? Is the hotelier? Like, does the hotelier need to be picking up the right mineral water? Like, will the checks and balances be applied over there?
No, all this is difficult to police, no? Difficult to know who's going to be checking all these things, right? So, now if I go to a restaurant, normally we all ask for, many people will ask for mineral water.
Yeah.
So, normally they will either come and show. So, you got to look at the brand, I think.
Yeah.
Buy something which is a known brand. There are so many, fly-by-night operators, or some, they just taking water out of the borewell, putting into these bottles and supplying with some brand. Many of them, and with hardly any proper processing. So that is there. So don't buy those. I think that is left to the consumer, I think, to look at.
Right.
And of course, the manufacturer, the supplier also, but for a supplier, he may be getting it at a lesser price. So he may not be thinking too much about it. He may be thinking it's good mineral water. So the guy who's supplying the water in the restaurant. So basically, I think, that's what we did. That buy good known brands. Because the quality of them is definitely better than these unknown brands.
Yeah. So there was another report that we read which said that the stunting rate is at 41.2%. So there's like a lot of malnutrition that is happening. What are some of the steps that we're taking towards?
So that is an issue. Even in Karnataka, we've got varying stunting issues within our own state. Certain districts do very well, certain districts are very poor. It's a long chain, starting from the health of a girl child. So it starts from there. So if the girl child is healthy, when she's born healthy, then she becomes healthy when she's older. And when she's of age when she can conceive, then she should have good nutrition, good food when she gets pregnant and when she's going to deliver. So her care should be better. So starts, it's a long chain right from birth to, because that's why the health of a woman is much more important than the health of a male, I feel. Because she's the one who's actually, the baby's health is dependent upon the mother's health. So if the mother is healthy, the baby is healthy. So if the mother has to be healthy, then she has to be looked after well.
Yeah.
Whereas in our society, we do the opposite. At least it's been going on, where the son gets better treatment, or in traditional societies and in traditional families, the son gets more preference in terms of education, in terms of food, in terms of all facilities, and we push the girl to the to the next category.
Yeah.
she is not the primary, she is not the priority.
Right.
So the priority should be the woman actually. Even if you want a better son, even if you want a better boy.
So beautifully said.
So that it starts there. And we've been looking at it. We've been, okay, of course, we have the Women and Child Department, which also looks at it. And to make the mother as healthy as possible when she's giving birth, in terms of nutrition, in terms of her health. There's a lot of anemia.
Yes.
So you've got to make sure that she is not anemic. And, she has got all the necessary health conditions, like that she's being monitored. And she should, she should prepare herself for the pregnancy, certain exercises, mentally, physically, all these things combined along with nutrition and medicines. And then when she gives birth, as far as possible, it should be a natural birth. And as far as possible, she should feed the baby, So it's like there are so many variables in this. The breastfeeding is so important. Natural birth is so important. So, and then the child, the baby that is born, first 4 years is the most important. Like stunting and formation, the brain formation, everything is in the first 3 to 4 years.
Right.
Especially the first 1 year is the most important.
Yeah.
So, bring all this together, then you'll solve the problem.
That's a lot of work. It's
a lot of, it's a lot of things, but not that it is not addressable.
Right.
It's all addressable, all doable, but it needs the right interventions at the right time, and people to be motivated and understand this. And that is what I am trying also.
Right.
In my own department for maternal health, and that's a key focus for us, because we saw a lot of maternal deaths happening in Karnataka also.
So the Anemia Mukt Paushtika Karnataka, that's part of what?
Yeah, it's part of this.
Okay.
So right now we have covered all this college-going children from I think 10th, 11th, 12th. Now we're attending to all the schools. So we want to make sure that they are not anemic. They come out of anemia. So we have different categories like severely anemic, moderate anemic, mild anemic. So we want them to, if someone is severe, we should want to push them into mild and finally become okay. So moderate, they should go to mild and become okay. So we monitor them also. So first we're doing that. Now we're doing with the school children and of course the pregnant women. So they should not be anemic.
Right.
Yeah. So that's our focus and it's a big program that we have launched, and we're giving it a lot of focus. Yeah.
That's brilliant.
Yeah.
There's a recent news on CBSE schools basically launching sugar boards to basically educate children about the amount of sugar that is there in all the junk food that is so easily available, in our surroundings. I think it's a great move.
It is very good move. In fact, from our health department also, we have written to the education department. In fact, we've made out a chapter of all these things which need to be taught to school children, and we've told them to include it into their school textbook. But I think this year they could not do because the textbook was already finalized much earlier and went for print also.
Right.
So hopefully, I don't know whether they've included anything in this year's textbook, but by next year, whenever they come up with the next revision of the textbook, we want them to include these chapters in their learning.
All schools?
For all the government schools.
Okay.
For government schools.
Right.
Yeah. So we want them to make this a subject.
Yeah.
We put in a lot of data into it and some charts and how younger people are getting diabetes, sugar, and what are the reasons, and make them understand that, this has a direct impact on their own health and their own careers, their own futures. So I think what CBSE done, I think even our education department can look at it.
Yeah.
And probably, try and follow that.
Yes, implement it across.
Yeah.
So the entire generation is going to grow up
knowing this.
Yes. Yeah. One of the things we are doing at Akshayakalpa is we have a program called Good Food for Schools, where we go to schools and we're teaching children how to grow their own vegetables. It's a 5-week program where children prepare the soil, they sow the seeds, we handhold them through the journey till the harvest is done.
So they can go back and do it in their homes.
They can do it in their homes, and they also have this understanding, right? Because we don't treat food the way it should be treated, right? Like when you know the amount of effort that goes into growing food, that you're going to look at and say, Mama, this is not nice, I'm not going to eat it, right? Like, but when you know the effort that has gone behind it, you're going to look at it very differently.
Differently, yeah. I mean, it's also magical, no? Planting,
Absolutely.
sowing the seeds, and then it grows, and then it bears fruit,
Yes.
or the vegetables come out, and then you eat it.
Yes.
It's got I think, something wonderful to it.
Yes.
Yeah.
And as a part of this, we're also teaching them how to read labels, like just like turn the pack around. Just because in the front it says something, it does not mean that's the truth.
Yeah.
When you turn it around, you'll know what is really there in the product.
Correct.
So, like, if more and more people do this, and if government also kind of does more of this, I'm sure,
I'll definitely pass this on
Thank
to
you.
our education minister.
So, what's next on your radar?
Next, I think, I don't know. I mean, we want to continue this. We don't want to stop. And we want to improve our lab facilities, all that we're working on, so that we're getting it properly accredited across Karnataka. Not only Bangalore, Mysore, Belgaum, Gulbarga. So we want to have proper food labs there, so that everywhere they can be tested quickly, easily, and with good standards. And we want to see how we can take this, like I said earlier, to make it more where the consumer gets more involved. How we can do that. So that's, I think, the next thing, because our focus really gets a lot into the health. I mean, on the other aspect.
Yes.
So this is something that we need to keep on, coming back to it and pushing it.
Yeah.
But we realize it's important, and a lot of people have given us feedback that what has been done has been great.
Absolutely.
That, I think, is something. And so I think that's why we're doing this podcast.
Yes.
Because if we hadn't done this, I don't think it would have called us. It would have called me.
Yeah. No, because it's making headlines.
Making headlines.
Yeah.
So I think we want to continue it, make it more effective.
Right.
And see how we can, we do a certain test and we sample certain things, and then we come out with the finding. Okay, then what next? Okay, we've done that. So how do we ensure that continues, so that it just doesn't become a one-off thing, and then it stagnates or it reverts back to the normal old way. So how do we ensure that these people whom we have told that this is bad practice, they're continuing, or they've changed themselves.
Yes.
Or they've adapted to the new way of doing it. So how do we make it more effective? I think that is what we're looking at.
Yeah. No, I think like something as simple as the cotton candy color changing.
Yeah.
I think is a sign that the consumer is rejecting it. And when the consumer, and why is he rejecting? Because he is now aware.
Yeah.
And when he starts rejecting it, then everything will have to start changing.
True. I think the best way is the market itself should demand it,
Yeah.
So anything that is imposed always will have a problem.
Yeah.
But once it is got a natural thing to it, like an organic thing to it, then automatically it takes off.
Yes.
So I think that's what we're trying to do. And like every time people ask me, okay, you've done this, now what's next? But I say, it's not that I can come out with what's next every time.
Right.
We want people to become demanding. People should say that this is what I want and this is what I don't want. The minute that starts happening, I think, automatically things will change. Like idli, the plastic thing. It changed because people said, I don't want this idli.
Yeah.
Or why are you doing it like this?
Yeah.
So then automatically things change. So that's what we are, that's going to be the focus. And of course, on this, like I said earlier, the thing about this bad food, that is the junk food, processed food,
yes,
and all these things. I think there is something that we need to really ramp it up more. I think in the regulatory mechanism.
Yeah.
And that is what I think we want to push Government of India to become more aggressive and change the rules, change the laws, so that we can be more strong in not only controlling it, but for people to know about these foods.
Yeah. So in the same podcast, we had someone who had come who said that in Sri Lanka, which is such a small country, the regulations are such that you have to put it on the front of pack. Yeah. How much sugar is there in this product? How much salt is there in this product? And I think fats. Yeah. Those are the three things.
Those three things you just put. This is a high sugar product. This is a high salt product. This is a high, fat, high processed, ultra processed product. Whatever, you just put that big and known. That itself will, I think, for many people who may be knowing about it somewhere at the back of the mind, but not realizing it when they're buying it, suddenly they look at it, I don't want this.
Yeah.
They should say, I don't want this.
Yeah.
then naturally things written somewhere in the back in small, hardly readable alphabet. Who's going to read that?
Yes.
Who's got the patience? You know.
As when we did this whole good food for school program, the final event that happened, children were going around and asking the parents. So they were doing a presentation to the parents saying, what do you read when you pick up a product at a supermarket? So like 3 to 4 parents answered saying, I look for MRP,
Yeah.
I look for expiry date.
Yeah.
That's it.
That's it.
They don't see anything else. And of course, like if it is hiding in fine print,
Yeah, nobody's going to go look at it. So it should be like on the face. It should be in your face, that message.
yeah,
So that I think if we can do, I think that will be a game
changer.
That will
Yeah.
be a game changer. And though there's a huge lobby, the manufacturers, food manufacturers lobby, which is the food processing industry, which will, I think, lobby the governments. But I think it needs somebody to take one strong decision and say, I'm going to do it.
Right.
And I hope we'll put pressure on our Union Health Minister, Mr. Nadda, whether if he can do it, then it will be fantastic.
Yeah. So there are two problems, right? Like in rural India and rural Karnataka, there is malnutrition.
Yeah.
And in urban India, there is obesity. And obesity is on the rise. So how do we strike a balance?
See, if you look at obesity, I think already many of your programs, they must have more experts many of the experts would have spoken that wherever economies have gone up and whichever state is more developed, that's where more of these non-communicable diseases are happening.
Right.
More diabetes, more high blood pressure, more kidney diseases, more heart diseases, more cancers. So Kerala, Karnataka, all Tamil Nadu, all the southern states are the leaders in non-communicable diseases because we are better off than other states in terms of economy and everything. And people are able to afford the bad food. That's the reality. If you go into rural areas, they're more healthy. Even if in Karnataka also, you go to many of the rural areas, they don't have high BP and high sugar. They have other problems.
Right.
But this they don't have.
Right.
They have better, natural deliveries. The
Yes.
mothers there, they have less cesarean operations. So that's more. You go to UP and Bihar, their non-communicable diseases are lesser, whereas they have other diseases and other problems. Our lifespans are longer. The southern states, our lifespans are longer, and our fertility rates are lower. And we are good in many things, but we are bad in this because of, I think, affordability. We are able to afford this. So we need to educate our own people now. That we are doing well on so many things, but we are the leaders in this. We are the leaders in cardiac arrest. We are the leaders in cancer. Kerala, Karnataka, all of us. So Tamil Nadu. So this is a problem of a developing or a developed state, nation. So in the West, I think, also if you go to US,
Yeah.
these are huge problems.
Yeah.
Obesity
Yes.
and non-communicable diseases are huge problems. Because the way they're leading their lives.
Yeah. I remember my mom in her generation saying that, diabetes was known to be a rich man's disease back then.
Exactly. Because you become somnolent, you become lazy, you're sitting in one place, you're working, no movement. All these things are adding up. So, I mean, we need to, and states like Kerala, which are more educated, they are facing the biggest problem. So, I think it's a problem that we have to face, which we are facing, and we need to tackle. We need to solve it.
Yeah. We have a small segment called This or That.
Yeah.
I'll ask you a few questions, and like from your personal choices, you can, let me know. Are you a conscious eater or driven by cravings?
I'm conscious. No, but mild craving. I won't say I'm perfect. Yeah.
Guided by taste or mindful choices?
Guided by taste.
Eat in or dine out?
Nowadays eaten. Eaten.
Because
Earlier
of
it was-
daughters?
No, on my own, because after becoming this health minister.
Okay. Order in or cook at home?
Cook at home.
Okay. Locally sourced ingredients or exotic flavors?
Exotic flavors, I don't mind.
Okay.
Yeah.
Organic or conventional?
No, I've not really been looking at it.
Okay.
Yeah, I'm not so specific.
Okay. Know my farmer or know my brand?
Neither. I don't look at anything.
Oh.
Yeah.
Snacking throughout the day or structured meals?
Because of my profession, we tend to snack a bit.
Okay.
Because so many meetings and people keep giving something or another. But left to myself, it'll be more structured.
Okay.
If I'm in a regular normal, but if I because of my profession, that's a problem.
Reusable containers or biodegradable packaging?
I've really not been focused too much on this.
Okay.
Yeah, because I don't order in anything. I never order food.
Okay.
So maybe in my house, somebody else might, but I prefer whatever's cooked at home.
Perfect.
Yeah.
Fresh produce or frozen convenience?
Fresh.
Food as nourishment or food as indulgence?
I'm somewhere in between.
Okay.
I'm not so much thinking about nourishment so much, but it's somewhere in between.
Someone else is doing that thinking for you.
Yeah. Yeah.
Energy bars or homemade snacks?
Homemade snacks.
Homemade snacks. Tradition versus trend?
Tradition.
Super.
Yeah.
So overall, what message would you like to leave with consumers in terms of the food choices that they make to make sure that what they're eating is good, healthy, what they're serving in their homes, what they're buying is good and healthy?
I think the best thing is to eat at home. Okay, indulge yourself once in a while, once a week, somewhere go eat and come. But if you can eat at home, what's cooked at home, whatever it may be, from wherever it may have come, that's the best solution.
Okay.
That's the best solution. Anything outside, you'll never know what it is. Maybe the topmost restaurant or the best place, we don't know, but ultimately we don't know.
Right.
So eat at home. Or eat home cooked food.
Home cooked food.
Yeah. Go to your friend's house and eat. Go to someone else's house and eat. Ask for home cooked food.
Which is what it used to be many years ago, isn't it? When you host someone, you would cook.
So that's the best thing.
Thank you so much for joining us and sharing all these insights with us. Thank you so much.
Thank you for calling me. I think it's first time for me to be talking about a subject like food, which I'm no real expert, but I think I've tried to do whatever I could do. And hope this program has been interesting.
Oh, it's absolutely interesting, and it gives us a lot of hope because we feel like, like there's so many times you'll be like, but nothing is happening. This kind of tells us that a lot is happening.
We can be optimistic.
We can be optimistic and hopeful. So thank you so much, sir. Thank you for coming.
Thank you.